Pain management really became the issue of our medical generation. Pain became a vital sign. Pain is the most subjective thing in the human experience. One person's 10 out of 10, the same thing may be 1 out of 10 for the next. Vital signs should be objective measures: blood pressure, pulse, respiration. That created a tremendous amount of confusion. This one paragraph letter that was sent to the editor of the New England Journal of Medicine described the addiction potential of patients in this clinic, 12,000 patients, and this doctor said, well, we may have had 3 or 4 patients. This single paragraph was picked up by Purdue Pharma and was then used to educate its salespeople on the fact that opioids were non-addictive. This was not a peer-reviewed journal. This was not a study that was in a paper. It was literally a single paragraph. This alone really helped to set up the extent of the opioid epidemic. I don't know how many times I wrote this exact same prescription in my 25 years of clinical practice. The truth was, again, we were told what you do hurts. You need to provide pain medication. You're going to use opioids because opioids are not very expensive and they're minimally addictive. How far from the truth was that? I'm going to share with you 3 numbers: 6, 13, and 30. The CDC did a study taking a look at a large cohort of patients. They basically said, if you give a patient a 24-hour prescription of opioids, what's the likelihood that they'll still be on opioids at 1 year? A single one-day prescription, 6 out of 100 patients may still be on opioids at a year. If you give a 10-day supply, 13 out of 100 may still be on opioids. If you provide them a 1-month supply, literally 30 out of 100 patients may still be on opioids. The truth is, opioids are highly addictive and should be avoided at all costs, especially for opioid-naive patients.